And then to make yourself even more well-rounded, you herniated your disc to be able to
Yeah, I
empathize with your
wanted
patient?
to put myself in everyone else's shoes.
That's great.
Cool. And after surgery, like I felt great. I mean, I was up and down stairs, like trying to be within reason, right? But I mean,
Right.
I felt great. Like
hmm
I was like, I can stand without pain. I can sit without pain. This is
Right.
amazing.
Sometimes the conservative methods just don't work. Today on Bed Back and Beyond, we are joined by Dr. Eric Broadworth. Eric is a doctor of physical therapy who, having herniated his own disc, tried the conservative methods but still ended up needing a microdiscectomy. He is here today to go over his experience, but also to give us some helpful tips. Hi, Eric. Thank you so much for joining us on the Bed Back and Beyond podcast. Before I dive into your injury, I would love for you to tell us a little bit about yourself.
Yeah, thanks for having me on here. So happy to, hopefully this can help others. But yeah, I'm a physical therapist. I've got my doctorate in physical therapy, and I specialize in orthopedic. I'm an orthopedic clinical specialist. I'm also a certified strength and conditioning specialist and certified in dry needling, which is a pretty cool technique. But I've always been an active person. Really enjoy working out, lifting weights, CrossFit, running, golf. I played hockey like my whole life. And then I own Fuel Health and Wellness, which is in Grand Rapids, Michigan. We for physical therapy, we really specialize in like active adults and athletes, but we do a number of things. We're very different than your typical traditional physical therapy business. We do red light therapy, we do the dry needling. We really strive in not only getting people better, but especially active adults and athletes, getting them back to really a performance side of things. So we see back injuries, we see people who failed other, conventional methods, or, they're just really serious about getting better. Those are the people that we see. And the red light therapy has been really cool. I'm also a part of a business called Red Light Systems, where we actually help other businesses market red light therapy and coach them in how to successfully implement red light therapy into their business. So those are several things that I do. Yeah.
And you can use red light therapy to help herniated disc or bulging disc?
Yeah. So, I mean, I tried everything I could to avoid surgery. In most cases, I will say, like, 80-90% are going to heal on their own. So if you're listening and you did have, you herniated a disc, you're really worried about it, you got the pain down the leg and it's awful, that can heal. So, and I recommend go the conservative route first. But if you do get to a point then that you've tried everything, surgery is an option to consider. And so, yeah, I used red light therapy. We get great results, I'll tell you that. And we actually just bought this class 4 laser, which is like really intense red light therapy. But we've got a bed, we've got pads, and it can really help the body to heal itself to a degree. So the research on it with back pain and stuff is a little mixed, but people love it on how it helps them feel. And if you did have surgery, strongly recommend red light therapy to help you recover. Absolutely, 100%.
The only experience I have with red light therapy is with my beagle, my dog. He has a bulging disc, and every once in a while it flares out. And recently the vet said, "Let's do red light therapy."
Yeah, they have a laser for them.
Yeah.
Cool.
So, do all physical therapists have their doctorate?
Not all of them, no. The more recent ones, like that have graduated in the last, I don't know, probably 15 years, do. That became more like they started implementing the doctorate in like 2006, 2007, around there. But before that, then was a master's, and even before that was a bachelor. So you have
Where'd you go to school?
I went to Grand Valley State University, which is the Grand Rapids, Michigan area.
Okay, great. I have a girlfriend who went into physical therapy and did her doctorate as well. I told her I had no idea. I had no idea that physical therapists got their doctorate.
Yeah, it's a clinical doctorate. So yeah, they make you go through the ringer to get that now.
So did you focus on orthopedics in your clinical for your doctorate?
So yeah, I mean, to get your like doctorate, like we had to have a number of different settings. So we had to be in like an acute setting, skilled nursing facilities, outpatient, hospitals. You could do home health. Like they really want you to get a wide variety. So then you really know what area you want to go into, and it also just makes you more well-rounded to understand like all the different facets of healthcare too. So I do think that that's important. But I've always really enjoyed working with, especially like the athletic population. So I kind of knew even like going into physical therapy that I likely wanted to go that route, and I really liked all the settings. But yeah, I stuck with the orthopedic route, the outpatient route, and then to get the orthopedic clinical specialist degree, that's extra training and a test that you have to go through. So it's kind of like taking my boards all over again, but very specific to orthopedics.
Okay. And then to make yourself even more well-rounded, you herniated your disc to be able to empathize
I
with your
wanted
patient?
to put myself in everyone else's shoes.
That's great.
I guess to tell my story on how I herniated a disc. So probably if I had to guess, like goes back to when I was 18 years old. I remember like hurting my back doing like a deadlift, something like that, but ended up healing. Like I've never even been to see a physical therapist until I became a physical therapist. But I'd have like on and off back pain for years, and really through my 20s, early 20s, like for the most part, I was pain-free, active, everything like that. You'd have the occasional flare-up of, I don't know, something. And then probably around like 28, I started to have like a yearly flare-up where it'd be like I'd go and I'd deadlift or I'd do something just right, and it like, it would kind of throw your back out, like a lot of people like to say, and you can hardly move, right? But I would do all the things, and within 2 weeks, I was good to go again, and I'd be back at it. And honestly, one of the best things you can do for your back is move. So a lot of people, just so you know, like bed rest, if you do something like that and you just want to lay in bed, that's like one of the worst things you can do, is just lay around. So the most recent, I guess, issue, let's see. I think, so I do a lot of like CrossFit style workouts, and not that CrossFit is bad. I think CrossFit is fine. I think you need to know though, like listen to your body, just like with anything. Like, I mean, you can do things like picking something up wrong, right? And I've had a number of different injuries over the last few years. I tore my pec in 21, was rehabbing that. And I think this is all like the body's very interconnected. Does that make sense? So this is why I'm giving you a little bit of background. Tore my pec in 21, came back from that, feeling good. April the following year, I was doing like a rope climb and felt a zing in that same like shoulder. Still don't entirely know what I did to that shoulder, but I did something. So that set me back, and I'm getting back into like some workouts and stuff. And I was really focusing on, so this would have been last fall, probably like September, October, around there, as I'm going to guess. I was focusing on like form, like slow squats, but I was loading up the weight a bit. And there was never one specific movement where it's like, boom, that's right there, that did it. I noticed one day after doing it though, like after the workout, I'm like, oh, my back's kind of like a little angry, right? And then the next day and after, like it was just kind of flared up. So then fast forward a little bit, I ended up herniating my umbilical, having an umbilical hernia, which is on the side, like belly button. Right. I had a small hernia there. That was caused by doing toes to bar. So for those of you who don't know what toes to bar is, bring your feet up to the bar and you're kind of doing like a swinging movement. And I really think what caused that though, is my left shoulder being weak and kind of compensating.
Because you're hanging when you're doing the.
Yeah, you're hanging. And you're using, you do need like shoulder stability, right? And so it was towards the end of a workout. My body is fatigued, everything like that. And I felt like a little bulge in my stomach. It didn't really hurt. I'm like, oh, that didn't feel normal. That didn't feel great. And then did a second one, felt it again. I'm like, okay, I'm getting down. I'm not getting a hernia. And then after I felt like my belly button, I'm like poking around and it felt crunchy. I'm like, oh gosh, this isn't good.
Yeah.
It's a super, super small hernia. Ended up deciding to have surgery on that. Just because those aren't going to repair themselves. It was like 1 to 2 stitches, not a huge deal when it comes to surgeries. However, like there's no such thing too as like, I will say like a minor surgery. All surgeries that you are cutting into the body, there is damage there.
Right.
But the day before that surgery, I was like, I'm going to get a sweat going because I'm not going to be able to do much for 6 weeks because I got to let that tissue repair. Right. And all I was doing was rowing on a row machine. I was doing some box jumps and I was doing sit-ups. And my back started out tight and it just got tighter and tighter and tighter during the workout. So halfway through, I switched to like biking, step ups, and planks. And it still just didn't get better. It just was super tight. And I'm like, great, I'm going into this surgery now with my back flared up. This isn't ideal by any means. So then fast forward like 6 more weeks after the surgery when I can start moving again and I get on a row machine, I'm getting the same like stabbing pain in my low back, kind of SI joint area.
Right.
And I thought, well, maybe like I just need to move. And so as a physical therapist, I will say this, like we aren't always like the best patients. I should have listened to my body more. I should have.
I think that's true against.
That's
true for medical professionals across the board.
And so this is where, to be honest, like I work with, I'm not afraid to go work with other people. And I tell them, I'm like, yeah, I'm PT, but you tell me what to do. Cause I don't like, it's self-diagnosing is not the best.
Right.
But anyway, I tried like pushing through the pain a little bit. And I knew I was in real trouble so this is February now. I was doing
this year.
Yeah. February this year. I was doing like some deadlifts and cleans and things like that with a barbell. And again, this stuff, I don't want to scare you from this stuff. This is stuff that you really need to incorporate if you do have back pain, but you need to do it right. And with someone, like if you're concerned, work with someone to do it. But it is very important to do. And I started getting numbness down my leg and the pain down the leg and then the weakness. I got the foot drop and couldn't raise up on my heel. And I knew I was in big trouble. Like, I'm like, this is not good.
Okay.
From there, I did everything. I did chiropractic. I saw my physical therapy team. I did virtual visits with a physical therapist that does the McKenzie method in New York, who's a super smart guy. I really respect him. I did other techniques with a physical therapist virtually in California. I saw another physical therapist out here she has her own technique and she thought she could save me from surgery. I did a cortisone injection. I did red light therapy. I did massage. You name it, I did it.
Right. Any relief with the cortisone at all or just nothing?
The weekend. Yeah. And I kind of knew like, this is either going to last and it's going to stick, or if it doesn't.
Yeah.
And one thing I will say too, like if you are looking into surgery, what I really respected about my surgeon, he knew my background and everything like that. And he's like, if you want to do another cortisone injection, we can do another cortisone injection.
Sure.
And I'm just like, it lasted 3 days. It's likely not going to stick again. I've got the weakness. And my daughter was just born September 1st. So at that point too, I'm like, I have 15 weeks. I'm like timing it all out to her due date. And I'm like, I want to be better and be able to be there for her and my wife and that, when she's born and 3rd trimester and everything like that. So, so ended up, he gave me the choice. I was like, we've tried everything. I'm like, let's just go ahead and do the surgery. So we did a microdiscectomy and hemilaminectomy at L4-5.
Okay. Was it orthopedic or a neurosurgeon that did your surgery?
Orthopedic.
Okay. Was it someone that you already knew or?
Yeah, he had a really good reputation. I didn't know him that well, to be honest. He actually lectured to my physical therapy class. I kind of forgot about it. And he's like, I probably lectured your class. I'm like, oh yeah, you did. And yeah, he came pretty highly recommended. And one thing that with any surgeon that I really appreciate, and I'm going to actually be interviewing him in my group. So if any of your people, we'll put it out on YouTube and stuff like that.
Yeah.
So if you want the link to that, I've talked to him. We're going to be interviewing him, but he really appreciates prehab and doing everything you can to avoid surgery. He understands the risks with surgery and understands that surgery should not be the first option. So if you're going to someone, and especially if you're like within 6 weeks, like, and you weren't in like a car accident, a major wreck or anything like that, like surgery should not be your first option. So I really appreciated that he didn't have, the God complex about him. And he really left it up to me and gave me the educational.
Did your MRI report happen to say how many millimeters your herniation was? Some people
no,
know.
I don't believe so. I don't believe so. Like, you could definitely see it on there on the levels. So, and when it comes to MRIs in herniated discs, people should also know too, like, just because something shows up on an MRI does not mean that that's what's causing your symptoms. So they've actually done studies when it comes to MRIs, and they've taken asymptomatic individuals, meaning these people have no pain, they have no issue, and they find herniated discs, degenerative disc disease, all these different things on these people,
right?
Yet they have no symptoms at all.
Right. Large population have herniated disc and don't know it.
They have no clue.
Yeah.
So the point being is, like, just because you have one doesn't mean that that's going to be disabling. It doesn't have to be. Now, can it? Yeah, absolutely. Like in my case, like, it matched up to kind of what we call a dermatomal pattern and myotomal pattern, meaning like the muscle weakness matched up to that level of the spine.
Right.
Same thing with my sensation changes and loss of sensation. And so I was showing nerve damage, right? Essentially, is what I was having. And that's where, okay, we're getting all those. That's where, yeah, surgery's more likely. I've gone more than 6 weeks. It's been more than that. It's definitely
right. And just to clarify, the dermatome chart is a chart that shows this nerve controls this area of your body. So if you're
dermatomes, dermatomes show sensation. So light touch, pinprick, heat and vibration, that kind of thing. So if you like numbness, tingling, so that's what you're looking for. That doesn't necessarily add up to your myotomes, which are a little different, which is like what nerves control what muscles. So like,
Okay. But it's a chart that says if you're feeling this sensation in this area of the body, then most likely this nerve is what's being irritated.
Yeah, it can be. And it can get pretty confusing too. I will say, like, again, make sure you're talking with a healthcare professional, because there's a lot of things that can cause that. So it's not always a nerve root. It could be a peripheral nerve. It could be a number of things. So I always say, yes, educate yourself, but also talk with someone too who really knows what they're doing.
Yeah. Then how long would you say someone should give themselves with trying physical therapy and other routes before they say, okay, this is not getting better, maybe I should consider surgery?
Yeah. So no improvement 6 to 12 weeks.
Wow. Okay.
Especially like that 12-week mark. You're kind of more so looking at that, and you have the weakness. Okay. And like sensory changes, not necessarily just pain. My pain was so bad. So I'm a physical therapist. I run my own business. I was laying down as much as I can. So patients would come in and I'm laying on my stomach because that was the only place for relief. Like, I couldn't sleep through the night. I got up, I bought an inversion table thing, which is here right next to me right now. And I would go lay on that in the middle of the night to try and get relief. Like I couldn't get comfortable at all. It absolutely affected my everyday life.
So your nerve pain was out of 10.
Yeah. I don't typically say like 10 for me is go to the hospital. I was like 8, 9, because like you didn't have to take me to the hospital. I did have a 10 after surgery. I will say that.
You did or did not?
Different story. But I did end up in the ER after surgery. Ended up being fine, but I had a really, really bad flare up. And I've been good since. So
yeah. My post-surgery inflammation got so bad that I thought I had re-herniated, but it just turned out it was inflammation and they gave me
What happened to me?
prednisone or something.
I spiked a fever. It was so bad. That's why they
Wow.
wanted me to go. I went to the ER, and that's
Mhm.
why I couldn't walk like 20 feet. My back was just seizing up.
Wow.
I think part of that was on me though. Did a little bit too much too soon. I did not
Mhm.
do anything the doctor didn't like surgeon. I followed everything he said, no bending, lifting, twisting after surgery.
Right.
You can stand, walk,
Walk. Mhm.
lay down as much as you want, limit sitting to 30 minutes 3 times a day. And I did all that. The one
Right.
day though, this was like 2.5 weeks after surgery, I owning my own business, like I would stand and work at a computer. Like I made a little standing station,
Yeah.
right? And so did that. And I was having like some chest pain and discomfort, which is a sign of a PE, not good. But it'd be when I'd lay down. So I was like, okay, well, I guess I'll just stand. I ended up like standing all day, not
Mhm.
good.
Mm-mm.
It didn't really hurt then, but the next day felt my back a little bit more. The day after it started to get bad, especially by night. So that was like Thursday night. Friday, I woke up. I couldn't roll in bed. I couldn't hardly get out of bed. I couldn't walk to the bathroom without my back seizing up.
Wow.
Um, and then I spiked a fever. So they had me go into the ER,
Mhm.
um, and did an MRI, which they're like, "You're fine. There's no."
Good.
I swear I had another herniated disc because
Right.
like I
Yeah.
had all the signs. I had
Mhm.
the slum test, the straight leg raise, couldn't straighten my leg,
Yep.
was
Yep.
shifted, like my whole body was like
Yep.
shifted away.
Mhm.
Um,
I was
and
2.5 weeks too when my
oh, were you
flare.
really?
Mhm.
Interesting.
Yeah.
Um, so I figured it was kind of what I did. So I just shut everything down, like bed rest. I talked to another physical therapist out of Florida, who's got very non-traditional methods. Um, and he's like, CBD, shut everything down,
Mhm.
PEMF, pulse electromagnetic frequency, if you can
Okay.
get it, which I have, and
Right.
grounding. So ground as much as you can. If you guys don't know what grounding is, watch the Earthing movie. So I sleep with a grounded pillowcase now and things like that.
Oh, okay.
Um,
Mhm.
so to just help the body heal itself and
Right.
inflammation and things like that. So
Okay.
I did all of those things. I didn't even do physical therapy. And then after 2 weeks, then I started to re-implement things. And
Okay.
I'm a super active individual. This has been extremely humbling. I was my rehab after that
Mhm.
was walking in a pool. And after surgery, like I felt great. I mean, I was up and down stairs, like trying to be within reason, right? But I mean,
Right.
I felt great. Like
Mhm.
I was like, I can stand without pain. I can sit without pain. This is
Right.
amazing.
Right.
Yeah.
Yeah. That happens a lot. People either wake up with still some pain and, and that's defeating, or they wake up and they're painless and then this pain starts to return. So I always try to tell people this is not a linear healing process. You
No,
you
it's
can
not.
at times feel like you're taking some steps backwards.
And
So
again,
how
not
many
all the so again, do everything you can to avoid surgery, but be
Mhm.
thankful too that surgery is an option if you really need it. Like I'm thankful that I had a great surgeon and surgery was a successful option.
how many weeks out are you now from your surgery?
I had the surgery May 19th, so it's November
Several
6th
months.
today. So what, we're like almost 6 months out.
Okay. And
Mhm.
can you say that you're starting to feel back to normal, or are you still
Oh yeah.
having some discomfort? Okay.
I mean, yeah, I have things I got to work on. I mean, if you're super active, like
Mhm.
it's gonna take time for your strength to come back. You
Right.
weren't doing like I have to really like check myself.
Mhm.
It's frustrating because I before this was deadlifting
Mhm.
300 pounds. I was squatting, close to like 300 pounds as well. And now like I'm doing Bulgarian split squats. I've got it up to 105, like 115 right now, doing sets of
Okay.
that and doing deadlifts with a little over like 100 pounds and doing higher reps and stuff. But
Mhm.
the focus is really like on quality of movement, making it pain free, and just slow progression to make sure I don't do this again. Because if you do have the surgery, understand there is a 20% of those will reherniate.
Right. Mhm.
So two
Yeah.
in 10, 1 in 5
Right.
are going to reherniate.
I'm
Not
at
to say
4
you need
years and I
surgery
haven't yet.
again. Yeah, not to say you need surgery again,
Yeah.
but you need to be careful. You need to listen to your body. You need to
Right.
do all the right things. Like that
Yeah.
should be a wake up call. Like, don't be fearful, but make sure you're
Mhm.
giving yourself the best chance. And again,
Yeah.
avoiding movement is not the option. You need to just do
Mhm.
movement in the right capacity and things like that. Sleep is huge, nutrition's huge,
Yeah.
hydration, all of those things.
Yeah. I'm one of those people who avoided movement because mine was a slow progression. I threw my back out in April from being pulled backwards on a walk with the dogs. And then, so that was the end of April. End of June is when the herniation happened. But from April to June, I was barely moving, laying
Mhm.
down on the couch as much as possible and not bending or anything. And then I had the surgery at the end of August. And I followed those no bending, lifting, twisting rules to a T, so much so that I think I even continued to weaken those muscles. And it was
Mhm.
my physical therapist who said, "Christine, you weren't putting traction." So,
Yeah.
and then he told me my muscles were misfiring now in the wrong order. And it was quite the recovery process for me because I
Yeah.
didn't move.
Yeah. Yeah. And so there's right. You don't want to do too much, but you don't want to do too little for sure.
Right.
The
Yeah.
body does have to heal, but
Yeah.
yeah, movement's medicine, but you got to do it in the right way with the right amount and things like that.
Right. I will say that my physical therapist was a godsend. I don't know if you include emotional training in
Yeah, we
your
we often
schooling.
have to help with the
Oh
emotional
my
side of
goodness.
things, and I can relate to that. Like with all my injuries over the past 3 years, I definitely have like um, anxiety about stuff and re-injuries and things like
Right.
that. So taking care of my mental health is just as important
Yeah.
as my physical.
Now I know not every doctor will assign physical therapy for someone who's had back surgery.
Mhm.
Are you of the opinion that everyone would benefit from that, or I don't know why they wouldn't tell someone to do
So
physical therapy.
yeah, so I guess there's a couple things there, right? So some doctors just don't believe in physical therapy. That's
Mm,
fine. That is what it is. They
okay.
just don't necessarily believe in it.
Mhm.
Um, or they've had a bad experience. There's such a wide range of physical therapy out there and like physical therapists who like good and bad, just like surgeons. There's good and bad surgeons, there's good and bad
Right.
everything. I'm glad you
Right.
had I'm glad you had a good experience with
Mhm.
physical therapy. That's often
Mhm.
not the case.
Okay.
What I would look for physical therapy is one that they're educated as
Mhm.
far as like if they have that extra degree, like that OCS, the orthopedic clinical
Yes, yeah.
specialist, or some extra
Okay.
letters. Not that that means anything. Like you can have a normal someone's fresh out of school and they're fantastic, but it shows that they did a little extra training.
Mhm.
They should always be switching up your exercises. You shouldn't be
Mhm.
handed off to a student or a tech or an assistant every single time. Like if you come in and you're doing the same exercises every single time, that's a red flag, and you
Right.
need to go see someone else.
Okay.
Um, Going back to your question about should everyone go see physical therapist, the research shows that with certain things like physical therapy doesn't necessarily improve your outcomes, and some people get better just fine without it, and
Mhm.
that's fine.
Mhm.
However, I think it doesn't hurt to go see a physical therapist, have them evaluate you at least once to make sure you're on the right path.
Right.
Because oftentimes, unfortunately, too, the surgeon's going to spend 5 minutes with you, be like, "Yep, you can walk. You're doing this. Great. Keep
Yep.
up."
And you leave with no
And you're
information.
like,
Mhm.
"Well, how do I get back to running, jogging,
Right.
weightlifting, golf? When can I do these things?"
Yes.
And if the surgeon's not answering those questions, like you need to go seek out more help.
Right.
Um, Physical therapists are trained in doing that. So even if like you don't want to go through physical therapy, I think getting evaluated by one and maybe having like a checkup or you do once a week or whatever. Personally, I think I mean we um I would recommend more than that. I don't think it hurts to see one for sure.
Mhm.
Um so I think it could be beneficial, but the research shows that you don't necessarily get any better outcomes. But I
Yeah.
see people the same thing as for hip replacements. Hip replacements, the surgery has shown that physical therapy like doesn't really get any better outcomes than people who don't go through physical therapy. However, I do see those people then who say have severe weakness into that hip, which then causes knee pain and things like that.
Right. It
All this
starts to
probably
affect
could have been
everything.
avoided if they started physical therapy right after the
Right.
surgery.
Right.
So at least having someone check up on you, either, yep, you're doing great, just keep on your own, or hey, maybe we need to work on this a little bit.
Yeah. I had done the physical therapy, and then I'm unfortunately one of those people who are like, hey, I feel better. I can stop my exercises now. And then ended up putting myself back into physical therapy about a year later because both my hips were starting to hurt on long walks. And so, like I
So
said, I have a girlfriend who's a physical therapist.
nice. So did you stop movement altogether, or you just stopped your PT exercises?
I stopped my PT exercise, and I don't think I was doing my cardio at that point. So I was just doing my normal daily, my work,
So
but no
yeah,
exercising at all.
so we really blend PT. Like you shouldn't have to do clamshells for the rest of your life. Okay. That drives me nuts.
Uh-huh.
We really blend it and
Unless you want
getting
a butt lift, right?
yeah, we really blend it from doing those simple little exercises. Once you can do those on your own, you're doing those at home. You're not coming
Right.
into our clinic and doing those. We're going to then progress you to doing uh, weightlifting or wherever your deficits are. So you could really look at, like, I tell my wife, like, hey, I got to do my rehab. My rehab now very much looks like fitness, and it is fitness
Yeah.
because we've
Uh-huh.
blended that, but I have make sure it's like I really focus in on my deficits and where I need to improve to keep my back moving in the right direction.
Okay. Are there any particular movements, one or two, that you would say everybody should be doing these for stability anyway?
I don't really like lumping in things, like
Mhm.
saying that everyone should do these movements.
Mhm.
I don't really like to say that. However, I guess what I will say is I do think everyone should be doing strength training. I don't think it should be scary. I think you
Right.
should be deadlifting and squatting, and maybe there's a variation that you do if you're not safe or comfortable doing a normal deadlift. But those two movements are foundational movements. You sit up and down from a chair every day. That's a squat, right?
Right.
If you need to
Mhm.
pick up your kid up and down from a chair every day, you're squatting with resistance. So doing those things and those
Mhm.
movements and switching it up, depending, the resistance might be heavy some days and lighter other days. I think it's super important. So really mastering those movements and in variety. I mean, that's how we get strong. If you're doing the same exercises over and over and over again, you plateau. You're
Mhm.
not going to get any better. You're not getting
Yeah.
any stronger. And they're just
Mhm.
kind of useless if you do the same workout, same PT exercises all the time. So
Right.
really switching them up. Mhm.
Any post-surgery equipment that you would think that you would recommend as
I
being.
have a video on that actually
Oh,
on YouTube. So I
okay.
can send you that YouTube link.
Uh-huh.
Things that I strongly recommend you getting, toilet seat, like razor.
Riser, yep.
Yeah, huge, because getting down to a low toilet, if you wait the first time you go to go do that, you're like, oh my God, what is
Yep.
going on?
Mhm.
If you can get an adjustable bed frame where you can raise and lower it,
Yeah.
that made it nice so I didn't have to like lay down, like, because you can be in a reclined position. So that was super helpful. A reacher and grabber, you can get one off of Amazon.
Yeah. That's the
That was,
must. That's the number one must for everyone is the reacher.
yeah, the reacher, the grabber. What else did I have on there? I mean, they give you an ice pack and things like that if you need
Mhm.
that. Um, Really things that most surgeons don't talk about is your nutrition before and after. Avoiding alcohol is extremely important even after. A lot
Okay.
of people think, oh, well, I'm off the pain meds, I can have a drink. Your body's still healing. Alcohol is a toxin. It will delay the healing process. It will cause
Mhm.
inflammation. It is not going to do you any good. So I would recommend avoiding any alcohol, not having any drinks for at least 6 weeks
Right.
would be best.
Okay.
Seriously. And then making sure you're taking the right supplements, having the right protein intake is huge to allow healing. So supplements include like C and D are super important
Mhm.
to help with the healing. Um, And again, I can send you the links on that. I've got all that. I've got a blog post on that if you want to
Sure.
check that out. But
Yeah, definitely.
yeah, all of those things to prepare yourself going into surgery so you come home and are going to heal well and yeah, not overdo it. But the razor, the reacher, you won't believe how many times like drop my phone. I'm like, Jess, can you grab that? Like,
Yeah.
can't
I
reach
always say
down.
get 2 grabbers for when you drop the first grabber.
Yeah. Make sure you have shoes too that you can just like easily slip on.
Definitely.
That was that's helpful, obviously.
Yeah. That's great. And then just for someone who does running, how long after surgery do you think someone can go back into their normal running routine?
Normal running routine.
Mhm.
It depends on what normal is.
Yeah, that's true.
So it depends on what normal is. I would say you're going to have to wait 12 to 15 weeks before
For
you
long runs.
start any running.
Oh,
And
okay.
running is then going to start out as like light jogging that's pain-free. And it's like
Yeah.
100 meters, quarter of a mile. You're doing a run walk. So for me, that was very light. And when I first got into running and jumping and like agility ladder, that was all stuff that I'd taken for granted. Like that was always easy for me. And I got back and I'm
Mhm.
like, I could feel my back, like my back would just be tight. Didn't feel
Right.
stable. It didn't feel stable or strong. I'm just like, oh my gosh. Like
Mhm.
it's just humbling. It's like you won't take for granted moving again.
Yeah. That is for sure.
Mhm.
So, tell me about your physical therapy practice then.
Yeah, we're very non-traditional. Like I've kind of mentioned, we really specialize in active adults and athletes. So people who want to get better. We see people after surgery who want to avoid surgery.
Mhm.
We work with a lot of CrossFitters, runners, golfers. We do pelvic floor. That's not my specialty, but I've got a physical therapist, Dr. Healy Van Beek, who I work with, who that's her specialty. We do assisted stretching, so fascial stretch technique. So that's really great can be good for rehab, but it's really good. We love it for like maintenance stuff for people who are really stiff and keeping them out of physical therapy by having them do that. We also do personal training, performance training, the red light therapy. So we're very holistic for sure.
Okay.
Nutrition. Yeah.
That's great. A lot of people look for that.
Yeah. Dry needling, which is
Yeah, can you explain
fantastic.
dry needling? It's different than acupuncture, right?
So very similar needle. It's a thin monofilament needle. They call it dry needling because we're not injecting the body with anything, right? It's
Mhm.
dry.
Mhm.
And it's a Western medicine style technique, whereas acupuncture is more Eastern medicine. It's more based
Mhm.
on traditional Chinese medicine with chi
Energy
and
flow and
energy
things.
flow and
Yeah.
everything like that. This is targeting specific trigger points. It's in the body. So like muscle knots and things like that in specific areas that are causing movement dysfunction. So it is more of a Western medicine approach. But depending on the issue, we can get very good results, especially when combined with we really like to combine that with the right exercises and things. So, okay, cool. The needle, we needle you, we get you more range of motion and flexibility and sometimes strength. And then we incorporate the right exercises to make sure you're moving optimally. And those right exercises are needed for just the long-term improvements.
Okay. And
Mhm.
then the red light that you offer, how does that help affect healing?
Yeah, great question. So, um, we have both red and near infrared light, and it has multiple wavelengths. You can get a home unit.
Mhm.
One of the home units that I recommend is like the Mito Red Light. The one that we have in our clinic, we've got a set of pads and we have a bed, which the pads in the bed have thousands of LEDs. Ours is very um, powerful and is really great for hitting whole body.
Mhm.
Um, and then we actually just purchased a class 4 laser, which also uses wavelengths of red light, and it's just much more concentrated. So it's much better for like acute injuries and targeting specific tissues. But yeah, basically what the red and near infrared can do, the near infrared can get a little deeper than the red, but it causes a change at the cellular level. So it can improve nitric oxide production, which increases vasodilation, which increases blood flow. it will help to speed up the healing process. It helped by doing that, and by also stimulating the mitochondria of the cell,
Mhm.
which is the powerhouse of the cell. If you remember
Mhm.
from like your biology
Mhm.
class,
Yep.
mitochondria produce ATP, which is energy for the body. So
Mhm.
it makes them more efficient at producing ATPs. And if our body's more efficient at producing ATP or energy, it's just going to be more efficient at healing in a number of systems. So a lot of really good studies on not only pain relief and healing, but also like improving strength and hypertrophy and performance, and really cool stuff there.
That's great. And your practice is called Fuel Physical Therapy in
So
Grand
Fuel,
Rapids?
so you could look up Fuel Physical Therapy or Fuel Health and Wellness. We actually did a name change. We still have a DBA as Fuel Physical Therapy and Sports Performance, but yeah, we're located right downtown Grand Rapids at the corner of Market and Cherry.
Okay. And for people who aren't close to Michigan, is there a place they can go to find more holistic style physical therapists?
Yeah, I mean, you can Google around, I guess, if you have questions and you want to message me and help to find someone, I can do that.
Mhm.
Uh, so yeah, again, there's so many different people out there,
Yeah.
and that's just tough. But there is, if you search, there should be someone really good in your area that you can find, that's not the typical like corporate care of just running a bunch of numbers. And
Yeah.
even if they are in that setting, it doesn't mean that they're bad.
Right.
You want to make sure someone that is paying attention to you, treats you as a person, and takes your goals personally. And it's not just like, okay, we want to have you walk around the grocery store. Well, if you want to run 5 miles, how does walking a grocery store help with that, right? So
Right.
making sure they're not just like, oh, well, your insurance only covers this much, you're done. Like,
Mhm.
no, that's not acceptable.
Right. And is your Facebook group also called Fuel?
Facebook group is called Fuel Your Health.
Okay.
Yep. Fuel Your
Great.
Health Facebook group.
Any last thoughts you'd like to say before we wrap this up?
No, I mean, I'll send you those links and everything. So if you want to check out my website, feel free to check that out. You can, if you have any questions directly for me, you can
Mhm.
call or text. Our work number is 616-757-0932. My email is Eric, ERIC, at fuelphysicaltherapy.com. But yeah, I mean, if you're thinking about surgery, good luck.
Mhm.
I think try all the things before. Um, and yeah, it is scary. Understand that that's all normal. I was super nervous. I never wanted to have surgery, that's for sure.
Right.
But
Right.
I'm grateful that I could have it. I'm grateful for the outcomes, and I'm
Yes.
grateful that it's really helped me to connect with my patients in an even better manner.
Right.
Ideally, I don't have to go through this, but I'm able to connect with people and empathize way better than I could before.
Mhm.
Being in that much pain sucks. Like,
Yeah.
there's no way around it.
Mm-mm.
It is miserable.
It's giving you a
Um,
whole new understanding.
yep. But there are people out there that can help you, and
Yes.
they are out there.
Right. Well, thank you so much for joining me and being willing to discuss your experience and your physical therapy practice. And if you are someone who is listening and you have a positive story of recovery from a serious neck or back injury, go to bedbackbeyond.com and click on the share your story link. I would love to include you on the show. Dr. Eric, thank you so much. It's been a pleasure.
Thanks so much for having me.